The FDA guidance for industry suggests that human cells, tissue, things like cornea, skin, bone, heart valves, if you have variant or other forms of CJD, you would not be eligible to donate. If you have history of CJD in a blood relative, same situation. Or if you spend a certain amount of time in the UK or Europe during a certain time period, you would not be eligible to donate. However, there aren't regulations from the FDA for organ donation, such as liver or kidney. There's no absolute exclusions. Organs can be donated if you had CJD, but they may or may not be used depending on the outcome of a risk-benefit analysis by the medical staff. New recommendations came out about this time last year, and I believe Lauren Crowder will be speaking about the Red Cross blood program a little bit later this morning. But briefly, the updated guidance removes the donor deferral criteria for BSE exposure, meaning if you were previously deferred for time spent in the UK, France, and Ireland, or receiving a blood transfusion in those areas, you may now be eligible if you meet other eligibility requirements. And this was a huge deal. We were contacted for years from people that spent time overseas that really wanted to donate and were being deferred. And now they are able to donate blood. People that are diagnosed with the Prion disease are still deferred. People who received a cadaveric HGH, human growth hormone treatment, or dura mater transplant are still deferred. So there are still some deferral criteria, but it has opened up a lot that will allow more people to donate. And again, that was based on an assessment of the risk involved. And what is that risk? Well, CJD itself has not been shown to be transmissible through blood. Again, we'll hear a presentation from the Red Cross later this morning, but there have been studies that have shown no evidence of CJD transfusion transmission. I have some quotes there from the Red Cross and CDC and the UK National CJD Research and Surveillance Unit, basically saying if this does happen, if CJD is transmitted by blood transfusion, it must be extremely rare if it happens at all. Now, that's different from variant CJD, which has been shown to be transmitted through blood. It's been reported in a handful of UK recipients of blood, interestingly collected up to 3 years before VCJD onset in the donors. And because many UK residents have potentially been exposed to BSE, there are still concerns about additional secondary spread of the agent through blood and possibly contaminated surgical instruments. However, as I pointed out, we haven't seen many variant CJD cases in recent years. The ones we've seen probably are due to occupational exposure, so that risk seems to be losing steam, which is great. And as I said, the deferral criteria has been adjusted in this country accordingly.